Hey friends, welcome back to Guess What? Compliance can be simple. I'm your host, Dr. Natasha Guess, founder of Guess Compliance Consultant LLC, where I work with small and mid-sized healthcare practices to build compliance systems that actually function in real operational environments. Now, last episode, we laid the foundation of this series. We talked about what compliance really is, where it lives, and what regulators are really looking for when they investigate. Now, if you have not listened to that one yet, go back and start there. Today, we will be getting specific. I'm going to walk you through the 5 operational pitfalls that create the most compliance exposure that I have seen in small and mid-sized healthcare teams. And here is what I need you to hear before we get into them. Most compliance exposure is not malicious. It is procedural. It is built into habits that nobody designed to be risky. And that is actually good news, because what gets built into a habit can be replaced by a better one. So let's talk about the pitfalls. The first one is informal access. Say, for instance, you have a front desk coordinator that needs to help the provider finish documentation before a deadline. Someone gives her temporary access to a clinical module, one that she does not normally use. They resolve the issue, but nobody removes her access. 6 months later, she is still in that system. HIPAA requires minimum necessary access. Every staff member should have access only to the systems and records that's specific to the role that they have. Not what is convenient, not what makes the workflow faster, what their job actually demands. And in many audits or investigations, access logs are pulled. Every access event that you cannot tie to a documented business purpose becomes a finding. The organization or your practice does not get to say it was a one-time accommodation. The log says otherwise when you look at the 6 months that front desk coordinator has been in that module, but it is not specific to her work. The next pitfall that I see is informal communication. For instance, a billing coordinator is resolving a claim dispute, and she needs to send a patient's insurance information to one of her colleagues quickly. She looks at the system, and logging in to the secure system takes 3 extra steps. She looks over at her colleague, they're on the phone, and she decides a text is much faster than taking those 3 extra steps to get into the secure platform. So she sends the text from her personal phone. The claim gets resolved. Nobody thinks about the message again until her phone gets lost in the parking lot 2 months later. Now, when this happens, your organization must initiate a formal breach risk assessment under the HIPAA breach notification rule. 4 factors: documented analysis, potential notification obligations. All of this from one text message sent because it was faster. Now, if the compliant option is also the inconvenient option, your staff will choose convenience every single time. And that is not a character flaw. It is human nature. And a compliance program or operation that ignores human nature is not protecting anyone. Pitfall 3 deals with outdated policies. This one I've seen quite a lot. Let's say a behavioral health practice implemented a telehealth platform 18 months ago. The intake process has changed. The documentation workflow changed. 3 new staff members were hired. The policy governing the patient communication and record handling has not been touched since you downloaded it from a template library 2 years before any of this happened. Your staff have quietly worked around the sections that no longer apply, and those workarounds have become habits. Those habits have become the actual process. And the policy sitting in the shared drive still describes a workflow that no longer exists. Now, if a regulator walks into your office and wants to see your policies, then sits with your staff members to walk them through how they actually do the work, that gap is what an investigation is built on. Your compliance program or operations needs to reflect the workflow you have, not the workflow you had when you wrote the policy. Changes happen. Your policies and procedures must update when those changes do. Now, pitfall number 4 focuses on business associate gaps. You have a practice manager. They signed a vendor agreement with a scheduling or billing platform 3 years ago. Since then, the vendor added a telehealth integration. They onboarded a subcontractor to handle payment processing. And they updated their data retention policies. None of those changes triggered a review of the original agreement. Your practice manager does not know any of it happened. What happens if an investigation occurs? Now, a signed agreement documents what the relationship looked like at sign-in. It does not update itself when the vendor expands their services, changes their infrastructure, or adds a third party to the data chain. The question is never whether an agreement exists. The question is whether the responsibilities in that agreement reflect what is actually happening in that vendor relationship today. And for most small and mid-sized practices, the honest answer is no. Pitfall number 5 that has occurred time and time again is having weak incident escalations. And to put this into practice, let's think about a medical assistant who realizes she sent a message containing a patient's date of birth and diagnosis to the wrong contact in the practice management system. She is not sure if it qualifies as a breach. She does not want to create a problem. So she checks to see if the recipient responds. They do not. She decides it is probably fine, and then she moves on. 3 weeks later, you get a call from the patient asking why someone contacted them about another patient's appointment. Now, your practice or organization is managing an active complaint, a delayed risk assessment, a documentation gap, and a potential notification obligation that should have been triggered weeks earlier. Most serious compliance exposure, it does not begin with a major incident. It begins with a moment of hesitation. Every hour between when an incident occurs and when it is reported increases your regulatory exposure. And early reporting does not create the problem. It creates the opportunity to manage it before it becomes one. I've given you 5 pitfalls. All of them predictable. All of them preventable with the right operational structure in place. In the next episode, we are going deep on pitfall number 1. process. We're going to talk about what minimum necessary really means and what happens when curiosity becomes a compliance event. I am Dr. Natasha Guess. Thank you for listening to Guess What? Compliance can be simple. Keep it simple, stay compliant, protect your patients. And I'll see you in the next episode.